Thank you so much. For my part of the evening, I'm going to talk to you about ultrasound and Alzheimer's treatment. One of my favorite things about working with Battle Creek is that there's this open dialogue where often Anne will text or email and just say, did you see this thing? Tell me, what do you think? People are asking about this thing. What is the deal with this thing? And so this is that talk, is to talk to you about this thing that we see. So the reason that this topic came up is because there was a segment on 60 Minutes recently that talked about this. And if you didn't see the segment, I will summarize it as such. The man on the left is a neurosurgeon. He's one of the first neurosurgeons to use deep brain stimulation. And he has developed an approach to Alzheimer's treatment that he's trying to convince the 60 Minutes watching audience is effective. And his evidence for that is that in the area circled in white on the right, there is more red than there is in the area circled on the left. We're going to talk about what that means, but to do that, we're going to talk about the claim that he's making in this study. So there was a 60-minute segment, and the claim that this neurosurgeon is making is that ultrasound, focused ultrasound, the same sort of technology you use to image babies, but like really, really focused and extremely powerful, can open the blood-brain barrier to allow anti-amyloid treatments, exactly the thing that my colleague was just talking about, allow them to access that amyloid more effectively and thereby hopefully clear amyloid better, right? That the area circled on the left will have less stuff in it because you've cleared out more amyloid. To unpack this claim, I want to talk to you a bit first about what the blood-brain barrier is. So I would like you to imagine your brain as a sort of thought factory where all of these different nerve cells are producing thoughts and feelings and emotions and things like that. And to do so, they need stuff. They need nutrients, they need oxygen, they need glucose, and in fact, your brain uses a disproportionate amount of all of those things compared to the rest of your body. It is, for its size, a very hungry organ. It uses a lot of nutrients, a lot of messages from elsewhere in the body, all sorts of stuff. So things have to get into the factory. This is why stroke is so damaging, right? Stroke interrupts the flow of oxygen and other things into your brain cells. Most of the stuff that's coming into your brain is coming in via blood vessels, arteries, right? But you don't want just anything coming into the brain because this is very delicate machinery. And if you let just anybody into the factory, you're probably going to get problems. So, like any factory, stationed at all the entrance are guards, these blood-brain barriers that I can't help but refer to as Barry. It just makes me laugh. So we're going to call him Barry, the blood-brain barrier. At every blood vessel, there is a blood-brain barrier that is screening all of the things coming into your brain. We're going to look at the anatomical basis for this barrier. Just to make clear, we're looking at blood vessels in the brain. We're going to move down a step and look at blood vessels as they are surrounded by other cell types that support them. The next slide, we're going to go even further down in magnification. We're going to take a cross section right through this blood vessel, and we're going to look at it like you were looking sort of down a garden hose, so to speak. So in the center is the flow of blood, right? This is a cross section of a blood vessel. This is where the blood is coming through. All of your blood vessels throughout your body are lined with endothelial cells. They make up the lining of those blood vessels. In your brain, and only in your central nervous system, your brain and spinal cord, those endothelial cells are different from everywhere else in the body. They create this barrier through which things cannot easily pass. How that happened in evolution, we do not know, but that is the case. They form these things called tight junctions, which, as the name implies, are tight connections with the endothelial cell, sort of to itself, to prevent the easy flow of things. Elsewhere in your body, oxygen and whatnot can leave blood vessels fairly easily. Here, that's not the case. This endothelial cell, which is the basis for the blood-brain barrier, is then supported by other cell types like pericytes and astrocytes that are just other support cells that help keep sort of everything in place. So what gets through the blood-brain barrier? Well, thankfully, things like oxygen and glucose. Oxygen can just sort of freely diffuse into the brain. Glucose needs to be transported into the brain. So it's sort of like having somebody meet you at security and escort you into the factory, right? So certain molecules are handled in that sort of escort manner, and some can just freely diffuse through. Lipid soluble molecules, so fatty things like triglycerides and HDL cholesterol, they can also get in the brain, which is good because, again, they're needed for normal brain function. Some hormones can get in. So, for example, the hormones that tell you that you're hungry or tell you that you have eaten enough need to get through the blood-brain barrier. They are produced elsewhere in your body, and then they get back into your brain to tell you if you need to keep eating or not. Some examples of things that don't get through the blood-brain barrier include viruses. Thankfully, now there are some exceptions to these, but viruses, toxins, bacteria, large molecules cannot get through. And 99.9% of antibodies that are in your body cannot get through the blood-brain barrier. So, to my colleague's point, if you in your laboratory have designed the perfect antibody for getting rid of amyloid, 99.9% of that is not going to get through, because every time it gets to a blood vessel, there's Barry. There are a couple of ways to trick Barry to let you take stuff into the factory. One was mentioned by my colleague Dr. Counts, which is to dress up your thing like something else that Barry is going to give access to. So, for example, if you adjust the chemical structure of your molecule to look like something that gets that escort, the escort will be confused and bring your molecule in, which is great. But altering the chemical structure of your molecule can also affect its function, which means maybe it can get in, but maybe now it doesn't work so well, or maybe it doesn't work at all. So, and Barry's a good guy, he's just doing his job, right? But there's another way that's been proposed to take him out, which is ultrasound, which is to yell really loudly in his face. So how does ultrasound work? Well, okay, we got to introduce some components here. On the right is a diagram of a blood vessel that is receiving this treatment. You are going to inject your patient with what are called microbubbles. I know everybody has seen a TV program, a murder program, where somebody puts like air into an IV and then that person dies. This is not that kind of bubble. These are very, very small bubbles. They're about a micron wide, which is like if you took an inch and divided it into 1,000,000 pieces, 2 of those pieces would be about the size of one of these bubbles. They are made of proteins that are normally found in your body, so they break down very easily. They are filled with gas, but the gas isn't a bad kind of gas. It'll just dissolve in your blood. It's no big deal. So you make these things because they have a unique property, which is that when they are hit with ultrasound, which is what's being diagrammed for you in that sort of vacuum cleaner looking thing, when those sound waves come in, these bubbles pulse. They shrink and enlarge. And that mechanical movement, sort of like a vibrating massage sort of thing, will open up that blood-brain barrier. And now drugs can get through. So if you do this process while someone is getting an infusion of Leqembi or one of these other things, the idea is that drug will more easily get into the brain and it will be more effective. Does that make sense? Okay. Is this safe? Is this a good thing? Is this okay? Well, this was first studied in mice in the 2010s. It's been studied quite a bit, just this process of opening the blood-brain barrier, not the part about combining with Alzheimer's therapy. We'll get to that in a second. Just the can you do this or not. It has been done repeatedly in small patient safety trials with minimal ill effects. Usually the side effect is headaches. But there have been a number of studies that have done this. Again, small patient numbers, 3, 7, things like that. Not a huge study, but enough to say this is probably okay. Here's an image just to sort of illustrate that. So on your left, those green areas, those are the target areas that we want to try to get this dye into just to test, is this technology safe or not? So those green areas, that's where we're trying to get the dye, and that's where we're going to focus the ultrasound to try to open up the blood-brain barrier. Image D there that's labeled baseline, this one here, this is before we do the ultrasound, you just put in the dye to see does it get into the brain, and it does not. There's no evident dye signal here. You then use focused ultrasound with these microbubbles, open up the blood-brain barrier, and now we see the dye in these designated areas. You then wait 24 hours, the blood-brain barrier reseals with no long-term ill effects, and now the dye doesn't get into the brain anymore. So it seems like it's pretty safe, right? This might seem counterintuitive the more you learn about the blood-brain barrier, because as it turns out, the blood-brain barrier falls apart or gets damaged in every condition that adversely affects the brain. Cancer, diabetes, Alzheimer's, you name it. Anything that affects the brain will cause the blood-brain barrier to weaken. It's like the factory, when the factory falls on hard times, some of the security guards get laid off, that sort of thing. So now there's more entry, and there's actually been a suggestion that that breakdown of the blood-brain barrier contributes to the pathology of the disease, because there's things getting through that aren't supposed to be getting through. So why would it be good to then hit that patient with ultrasound? And the way that I've conceived of this, and maybe this will resonate with you,
is like, if your house is on fire, it's okay for the fire department to kick down the door to get the water that you need to put out the disease, right? And they'll put the door back up in 24 hours, it'll be fine. This is that kind of like focused, almost surgical intervention using ultrasound to open up the pore and get these chemicals through. Does that make sense? There are other drugs, there are other treatments being looked at restoring the integrity of the blood-brain barrier to try to interfere with the disease process. And that's a different talk for another time. So does this work? Is this guy right? Unfortunately, I don't know. The reason is the study that he is presenting in this, and I'm not sure how he got this spot on 60 Minutes, but other people have done the same sort of study. They've seen sort of similar results, which is they've taken very few patients. And the results are, I mean, they're okay. Unfortunately, these results are usually reported using what are called representative images. So they did the treatment, they put in a tracer for amyloid. The red there is amyloid, so the more red means the more amyloid. The area on your left is an area where they use this ultrasound to break down the blood-brain barrier, and they're saying, look, it's cleared. But what they did was they just picked a bunch of images, and then they analyzed those images and said, oh yeah, there's less here. My concern with that approach is that this is also a marketing thing, right? He wants to get word out of this. They're selecting the images. It's a bit like if you're showing your vacation photos, you're showing the good vacation photos, right? You're not showing like, here's where we got stuck in the line at TSA. So I don't know how representative these things are. And there's very few patients who have received this treatment so far. So maybe, I would say it is, my scientific opinion is it deserves more study. That's about as good as we can get at this point. But who knows? Hopefully anything that can help get this through would be beneficial. Okay, that's all I got. Thank you so much for your attention this evening.